G'day, Paul McNamara here, just doing a quick online version of a presentation we're doing at the upcoming Eating Disorder Forum. And this one obviously is about supporting the assistant in nursing, particularly when they've got the role to support the person who's been hospitalised for nutritional restoration in eating disorder. Not all that long ago I had somebody say, what does an AIN do? They just seem to sit at the end of the bed like a angry cat. Now, look, if they are coming across that way, maybe we're doing something a little bit wrong. The role of the AIN in supporting the person with an eating disorder is to act like a bit of scaffolding, really, while the repairs and maintenance are done as part of their nutritional restoration. So scaffolding might include things like using the Mental Health Act, having the AIN there to stop the eating disorder taking over and sabotaging the recovery, or to support the person with meal completion. And of course it's just a temporary role, and once the person has negotiated that most difficult part of the recovery, I think, that nutritional restoration, we take some of that scaffolding away once the repairs and maintenance are done. So that's the role. What we just need to sort of think about for the AIN is their role in the hierarchy of the organisation. And there is an argument about whether or not they should be called nurses at all, because they're actually unlicensed health practitioners. So they're assistants in nursing, not nurses. So you can see here that registered nurses do a 3-year degree and they're licensed by APRA. Enrolled nurses do a diploma, which takes 18 months, also licensed by APRA. But the assistants in nursing do a TAFE certificate 3, which is a 6-month thing, and they don't get licensed by APRA. So what that means is that we can delegate tasks to AINs, but we can't delegate responsibility. That belongs with the registered nurse. That plays out here in this little bit complicated to look at first glance diagram. So the green line shows the collaborations. You can see there that hopefully we all collaborate with each other in the health team. But when it comes to delegations to the unlicensed health worker over there on the right, that's the assistant in nursing, it's only registered nurses who delegate to that unlicensed health worker. And so that's really important, I guess, particularly if we go back to that thought, if people don't understand what the AIN's doing, are they getting decent instruction, decent support from the registered nurse? So the assistant in nursing works under direct instruction and supervision from the registered nurse, and we have to take into account their skill and competency level. There's a AIN who works on GenMed, one of the wards at the hospital where I work at, Sharon, and she's very skilled with her interpersonal skills. She would be teaching a lot of us RNs how to communicate effectively, how to set boundaries without being too rigid and concrete and black and white with things. So she's got a really good skill set, but not every AIN has that skill set that Sharon has. So we have to take into account the skill and competency level of the AIN providing the care, and we have to remain very aware of that their scope of practice is pretty limited when you're working as an AIN. So what do we do to get around that? Well, we give really clear instructions. So this is a screenshot from IMR, our integrated electronic medical record, and we will put in a file entry that we print off specifically for the AINs, and that explains why the patient's here, what the role of the AIN is why we've got them there. You'll notice that it says nothing about acting like an angry cat. It's to keep the person safe, and then it gives a list of things about what specific tasks that they should do, and that's going to vary, of course, from person to person, and even during across the duration of their stay in hospital, what the person might need at the beginning of the hospitalisation will be different what they need after they've been there for a week. So we need to spell that out. and what the role of the AIN is. So typically it'll be things like I mentioned before, making sure that the eating disorder doesn't take over to sabotage the either refeeding either with the NG or with meals, and often that a whole process of progressing from an NG feed to oral meals is a really difficult time. So to offer some support and distraction during that time, that's the role of the AIN. Anyway, that's all I've got to say about that. If you need to